everyone, welcome back to my YouTube channel. This is your host Mamta Guer. Today in this class, we are going to discuss about the important questions related to the cardiovascular system. So don't go anywhere and watch video till end. Questions are limited, but surely it will be very much helpful for all of you if you are doing the preparation for your examination. So before starting the class, do not forget to subscribe my YouTube channel and also press the bell icon so that you will be getting the early notification of my next YouTube video.
The first question is, what is known as heart of the heart? Your options are AV node, SA node, tricuspid valve, mitral valve, and the right answer is SA node. Next question, Heart Day is celebrated on, and the options are 29 September, 30 September, 12 June, 15 August, and the right answer is 29 September. Next question, in India, first heart transplantation was done in the year, and the options are 1965, 1966, 1997 or 1968, and the correct answer is 1968. Next question, total time taken by one cardiac cycle is, and the options are 0.18 second, 0.8 second, 8 second or 0.12 second, and the correct answer is 0.8 second. Next question, the largest chamber of the heart is, and the options are right ventricle, left ventricle, right atrium or left atrium, and the right answer is left ventricle. Next question, the cardiac output can be detected by, and the options are stroke volume plus heart rate, stroke volume multiplying by heart rate, stroke volume dividing by heart rate, or option D, stroke volume minus heart rate, and the correct answer is option B, stroke volume multiplying by heart rate. Next question, total number of pulmonary veins found in human body, and the options are 2, 4, 5, 1, and the correct answer is option B, 4. Next question, pulse regulatory center in the heart is, and the options are AV node, SA node, left ventricle or none of the above, and the right answer is SA node. Next question, which is the most common site of MI, myocardial infarction, and the options are option A, posterior wall of the heart, option B, lateral wall of the heart, option C, anterior wall of the left ventricle, and option B, posterior wall of the right ventricle, and the correct answer is anterior wall of the left ventricle. Next question, Dressler syndrome is also known as, and the options are early pericarditis, second, Wolff-Parkinson-White syndrome, third, Marfan syndrome, and the fourth, early pericarditis, and the right answer is option A, early pericarditis. Next question, which chamber make apex of the heart, and the options are option A, right ventricle, option B, left ventricle, option C, right atrium, and option D, right atrium, and the correct answer is option B, left ventricle. Next, the term used to explain right side location of the heart in the chest is, and your options are Dextrocardia, ectopic cordis, pericardia or ectocardia, and the correct answer is Dextrocardia. Next question. Duke's criteria used in the diagnosis of which diseases? And the options are rheumatic fever, option B endocarditis, option C myocarditis, and option D pericarditis. And the correct answer is option B endocarditis. Next question. Which one is the most common early sign of digoxin toxicity? And the options are option A vomiting, option B anorexia, option C headache, and option D chest pain. And the correct answer is option B anorexia. Next question. Which one is the most common acyanotic heart disease? And the options are ASD, VSD, PDA, or TOF. The correct answer is option B VSD, means ventriculoseptal defect. ASD means atrial septal defect, PDA means patent ductus arteriosus, and TOF means tetralogy of Fallot. So among all these four, the correct answer is VSD, ventricular septal defect. Next question. Most common type of hypertension, and the options are secondary hypertension, primary hypertension, essential hypertension, and both B and C. And the correct answer is option D, both B and C. It means primary hypertension as well as essential hypertension. Hemorrhagic shock is otherwise known as, options are anaphylactic shock, septic shock, hypovolemic shock, or neurologic shock. And the correct answer is hypovolemic shock. Next question. Which one is the most common vein to get thrombosed first? And the options are posterior tibial vein, popliteal vein, saphenous vein, or anterior tibial vein. And the correct answer is posterior tibial vein. Next question. Drug used as a drug of choice in myocardial infarction. And the options are morphine, aspirin, anti-G, or atropine. And the correct answer is aspirin. Next question. Saddle shaped ST segment elevation found in which condition? If we are talking about this ST segment, it means we are talking about the ECG. So your options are pericarditis, endocarditis, myocarditis, and cardiac tamponade. And the correct answer is myocarditis. Next question. Rise in the carotid sinus pressure leads to, and the options are reflex hypercapnia, reflex hyperapnea, reflex bradycardia, or option D reflex tachycardia. And the correct answer is reflex bradycardia. Next question. Most common type of heart failure is, your options are left-sided heart failure, right-sided heart failure, both A and B, and none of the above. So the right answer is left-sided heart failure, option A. Next question. Which cardiac marker rises first in the myocardial infarction? And the options are myoglobin, trop-I, trop-T, or option D creatinine kinase. And the correct answer is myoglobin. Next question is normal range of CVP, central venous pressure. And the options are, this means if the questions are coming in like this, means normal value, so it is very confusing. We have to remember all these things. And the options are 2 to 6 mm Hg, 10 to 20 mm Hg, 12 to 15 mm Hg or 20 to 30 mm Hg, and the correct answer is 2 to 6 mm Hg. Thank you so much. So this was for today class. Keep studying and all the best for your exam.